One of the largest stroke prevention trials ever conducted involved Intermountain Medical Center.
Carol Makita reports that at-risk patients now have more options. Carol.
Bruce and Deanie, the study compared two different procedures for some patients who had had strokes, others who were at risk for one. The findings, doctors say, are changing medicine and saving lives.
Stroke remains the third leading cause of death in the United States. But Utah patients are now benefiting from the results of a national trial that involved Utah researchers. The 9-year study used more than 2,500 patients. Doctors in 117 medical centers, including Intermountain Medical, researched the procedures.
This is a carotid artery that's coming up into the neck from out of the chest, and it divides into two branches, one of which supplies the blood to the face, the tongue, and so forth, and the other continues up to go into the skull and supply the brain.
Plaque builds up at the divide. Blood clots form and travel to the brain, causing strokes. In the traditional surgical procedure, the doctor makes an incision in the artery, cleans out the plaque, and sews it back together. In the less invasive, newer stent procedure, the surgeon first measures the artery size, then threads a stent and expanding device to widen the blocked area.
In both surgery and with the stents, the complication rates were the lowest ever reported in a trial.
The new stent procedure also includes a butterfly net to catch plaque particles that can cause future strokes.
Surgery and stents used to be only for high-risk patients. Now average and low-risk patients are receiving them.
Patients who aren't thought to have a high risk for surgery because they have the bad lungs or some other sort of thing like that, or that they're just so frail that they can't recover. These are you and me patients.
Hopefully not right now, you and me patients. This study also had the benefit of leading to fewer days in the hospital for the patients. For information on stroke prevention or the warning signs, there's a link on our website, KSL.com.
Thank you, Carol. Newly released documents